So welcome to the first Breathe podcast. My name is Brian Kent. I'm the chief editor of Breathe. And we're delighted to have our first podcast being focused on our early career members, and particularly on our early career members' experience at the Congress, which was recently held in Milan, and I think was really a great success with really great turnout from ECMs and from old people like me. Joining me today is Joana Patricia dos Santos Cruz, who is one of our lead ECMs. And I'm going to ask Joana to introduce Siyu and Sarah, who are joining us to tell us about their experience at the Congress.
Thank you very much, Brian. Thank you so much for having me here also in the podcast. Welcome, Sarah and Siyu. So Sarah Alami, she's from Assembly 4, is sleep disorder breathing, and she presented at the ERS Congress the poster clinical and economic assessment of a comprehensive program to improve adherence of continuous positive airway pressure treatment in obstructive sleep apnea patients in Spain, a randomized controlled trial with a health economic model. And Siyu Dai, she's from Assembly 6, epidemiology and environment, and she presented the poster The Causal Relationship Between Smoking Conditions and Telomeral Length, a Mendelian randomization study in the UK Biobank. Right? Thank you so much for attending. So we have prepared some questions for you to know what were the highlights of the sessions in your perspective. So we would start for this question. In your opinion, and I can start with Sarah, for example, in your opinion, which were the main highlights of the ERS Congress for your assembly? Which sessions caught you the attention the most?
Thank you. On my side, I think the two topics caught my attention. The first one is on the benefit of adequate CPAP adherence and personalized maintenance. I attended a presentation on real-world large dataset studies or post-hoc analysis demonstrating the positive impact of CPAP treatment on reducing cardiovascular morbid mortality, especially in adherence and symptomatic patients. And it's particularly interesting as it challenges several RCTs that failed to show a benefit of CPAP therapy on cardiovascular events. And I also delve into session highlighting the need for targeted and personalized treatment approaches for sleep apnea. And markers like hypoxic burden were discussed to assess the risk of cardiovascular disease.
Thank you so much. We can see that there were a lot of highlights in this year as Congress, so thank you. Now we can move on to see which were the main highlights. Do you want to identify some?
For the highlights of our Assembly 6, in fact, this is a really big topic for me. So according to my own understanding, because the same of this year, right, we have the pollution, climate change, and also sustainable development. So when narrowed to our assembly, I think the highlight could be because we epidemiology group always focus on the epidemiology and also those risk factor identification of respiratory disease. So I think the highlights can be, for instance, the determinants, especially those airborne pollutants of the lung disease in both children and also in adults. And also, I think the highlights can be the emission source, the dust storms, and the climate change, what the impacts on our lung health, and also the prevention of chronic respiratory disease prevention through, for instance, the occupational and also environmental exposure management. And furthermore, I'd like to add is that I think there's also one more highlight is that the impact of the COVID-19 pandemic in respiratory health from an epidemiological aspect. Yeah. So the session which caught my attention most, I think it is a session entitled as Working Against Tobacco and air pollutants, the other big pandemic. I think this session also, another very important session for me is a pediatric in review, because I'm from the Department of Pediatrics.
I was wondering if we could talk a little bit about the research that you presented, because it's always one of the most exciting things, I think, when you're an ECM within the society, is being able to show what you're bringing to the table and getting an opportunity to show off some of your own work. So, Sarah, I do sleep medicine. I look after people on CPAP all the time, and adherence is a big problem in CPAP. You've done some work on this and presented it at the Congress. Could you maybe give us a little bit of an idea about what you found and what the reactions to it were like at the Congress?
Yes, of course. I presenting the clinical and economic result of PIMA program. So PIMA program is a proactive program designed by home care providers to improve PAP adherence and patient quality of life based on patient stratification and personalized support plans. A Spanish randomized control trial demonstrated a significant improvement in PAP adherence versus standard of care. And at 1 year, 80% were adherent in the PIMA group compared with 66% in the control group. And using this improvement, health economic model estimates the clinical events and cost avoided for different scenarios on the eligible population, ranging from the current impact to the potential maximum impact if PIMA were to become the standard of care in Spain. So from the Spanish healthcare perspective, the maximum potential economic impact could be around 200 million. And from a societal perspective, including indirect costs, savings could reach around 500 million.
That's incredible. Can you tell us a little bit about what the program involved and what level of initial investment is required to deliver those kind of savings?
Yes, it's both human resources and material resources, because it's this program needs to have specialized people, motivational interviews, capabilities, and with a lot of educational support, and also some digital tool for communication between clinician and home care providers and patients.
And do you see any barriers to having this program rolled out in other European countries?
Yes, so widespread deployment requires significant resources, and according to countries, so some adaptation may be necessary to comply with regulation and ensure sustainability.
Thank you, Sarah. Now, moving on, also, we would also like to hear Siyu. So, your research was focused on environmental impact on respiratory health, and you said that were some sessions on that also, some important sessions. So, your research was specifically on the effects of smoking conditions on telomere length. And how do you believe the findings from your study can contribute to a broader understanding of the environmental variables and the influence on respiratory health?
Yes, thank you for your question. So let's move to my own research. So the study I presented this year focused on the effects of smoking conditions, for instance, current smoking, etc., on 10 millionths, which is a biomarker for aging. And we find that current smoking was very significantly associated with a shorter of telomeres, which indicating impaired tissue repair, regeneration. So in other words, we conclude that hazardous environmental exposure can lead to accelerated aging. And so for broader understanding, I think that our finding highlight, first of all, we highlight the impact of smoking condition on respiratory health. maybe at a molecular level. Furthermore, by establishing a causal effect of smoking on shortened telomere length, we emphasize the importance of smoking cessation. We go further here. So in reducing the risk of respiratory damage. Furthermore, according to my own understanding, we think that this study also highlights the feasibility of using epidemiological research methods such as Mendelian randomization for the understanding of environmental factors and the impact on our respiratory health.
Thank you so much. This is a very important topic of research because we try to slow down aging, and this is one modifiable factor, right? So
thank you.
So how can we reach the communities also to help them understand your research and also to do something? So try to implement smoking cessation programs, or being aware of this.
Yes. So yes, as you say that the main finding of this research, we think that can guide our future strategies, such as in fact health education and also the relevant health policy development for the prevention and also intervention for the cessation. So according to my own experience, my understanding, so I think that we can first of all deliver those information to our public. I mean, for the public, for their health education, especially deliver those information to people have smoking habits. Furthermore, maybe we'll lead some training, in fact, to train our healthcare workers. I mean, not only clinicians, but also maybe, for example, nurse, PT, etc., to learn, understand this information for the smoking cessation counseling and treatment, etc. Yeah. Thank you.
Thank you so much. Just the last question also about your work. So in terms of smoking exposure, do we have like a relationship for time of exposure and influence on the telomere length?
Yes, I'll also look at that because in the previous analysis, we also identify the relationship between the PAC year and also the telomere length, because the PAC year is, in fact, it is the index for the lifelong tobacco smoke exposure. So we can also conclude that the longer time the individual smoke, the more impact, the harder impact they would have on their biological aging. Yeah.
I think you guys have presented some really important, the two areas you've looked at are really critically important in terms of our ability to deliver care and in terms of long-term health outcomes. And it's amazing to see early career members presenting their work like this. How do you think the society should be working to try and encourage ECMs to take on a bigger role at the Congress? Are there things that the society could do to make it more likely for your fellow early career members to attend and to present? I mean, what do you think, Sarah?
Maybe a mentorships program could motivate to have a mentor, identify in the international community, to be able to ask questions, to train before oral communication, something like that.
And Siyu, what do you think we should be doing to encourage our ECMs to be more excited about coming to the Congress?
Yeah. So first of all, in fact, I had joined this year's LEX program. The next program. So I think that is really a very wonderful, memorable journey for me. So I think that we can keep and also maybe have more such program. This is the first point. And also I think that mentorship is very, very important. Maybe we can have mentorship during the Congress or develop the mentoring relationship, etc.
So you mentioned the Next program, and not everyone will be familiar with the Next program. Can you just very briefly say what it was and what it involved and what you took from it?
Yes, of sure. So the Next program is it is invited some young scholars and also from different specialty, from different research field. Them come together. Then we have some mentors, maybe mentors here, very senior doctors and researchers here. And also we young people will, first of all, the seniors will have lectures in not only how to be a good doctor in respiratory health, how to do research in respiratory medicine, but also they presented how to have a work-life balance. So when both learn and we also communicate, and we also have new friends, new mentors here. So it is a program, like this. So briefly, it is maybe like its name, Next. It is for to nourish the next generation of experts in respiratory health. Yeah.
Yeah, it sounds like a really exciting program. I'm just sorry that I'm too old to be allowed in the doors, so it's unfortunately I don't get to do it. But it sounds like a really great program. Sarah, do you think you'll go next year?
Yes, of course, I will be present next year, and I hope I will be able to present new findings if the timeline allow it.
Brilliant. I'm looking forward to it. And Siyu, will we be seeing more about telomeres in Vienna?
Yes, I think sure, because I think that ERS Congress is in fact one of the most important thing for me. Yeah, and because I think I've learned a lot, and also I like travel around. Yeah.
So, Joanna, any other closing remarks or anything else you'd like to ask our guests before we all escape?
No, I think in terms of questions, they were mainly it. I would like to thank you once again for attending here and for presenting your work and for representing also the early career members at the Congress. We need you again, and we need for you to bring other ECMs. They will be very welcome. And thank you for having a time to discuss some of the highlights of the ERS program. I hope to see you soon in Vienna.
Yes, hopefully we get to see you in the real world soon, guys. But thank you very much for joining us today.